Oh my goodness, had to pull over to tell you this one. You guys been seeing those lines in the sky? Yeah, well, I just got this article and you guys are gonna drop your jaw on this one. Headline's reading, government begins testing on inhaled COVID mRNA. They're calling it AeroVax. Real crazy information that may affect you coming right up. Hey guys, my name is Cohen here at Riverside Homestead, and if you're brand new here, welcome. And if you guys are into prepping tips, emergency preparedness, and most important, news and awareness that affects you, be sure to start this video off with a like, hit that notification bell so you guys can stay up to date, and let's begin. Welcome back, folks. And if you guys like these daily updates, staying aware, me doing the digging for you, hopefully bringing you some value, scratching the surface so you guys can deep dive some of this stuff on your own. But seriously, keeping you guys aware, hit that thumbs up. And if you guys find value in this, please share this out, and for sure tell me what you're thinking down in the comments. Let's get going. Like I said, I had to pull over just to share this with you because I was just like, my brain's spinning right now. Article headline, and you know, if this begins in one place, it just circulates. And this is close to home, folks, close to home. We all see those lines in the sky. Canadian government begins testing inhaled COVID mRNA, and they're calling it AeroVax. I'm saying it like that because if I say the real stuff, folks, nobody's gonna see this video. This is why your likes, your comments, and your shares mean the world, because that tells the computer systems to send this to more people. So this article reads, and am I worried about those lines in the sky and what is actually coming down on us? We already know. If you guys do a little bit of research, they've already talked about what they're doing to the sky, reflecting the sun's rays so that it cools the whole earth. Let's just face it, they can basically drop anything. The article reads, the Canadian government has begun ramping up testing for a chilling new COVID mRNA AeroVax that could seek to overcome vaccine hesitancy. Do you know what that means? That means if you don't like it, you're gonna get it anyway. And you know what? Honest truth, like if it comes down to that, if it hasn't already started anyway, hypothetically, if that's the case, what can we actually do about it anyway? Like, we're basically subjected to whatever they do. And folks, as far as the lines in the sky and what they've been doing, which isn't clouds and isn't exhaust from the plane, has been happening for decades. And they're just softly rolling this thing out. Anyway, right where we picked up, vaccine hesitancy by using aerosols to vaxaroo the general public. Now, to save my bacon, this is all gotta be a joke, right? Completely a joke. Nothing I'm saying is true. Like I said, you guys know why I gotta say it like that. Unlike traditional vaxaroos that are deployed using injections, the new AeroVax is an atomized spray that is inhaled. Now, like I said, this is why I pulled over. Tell you this because I have a handful of people from our community, just like you guys, that send me tons of great stuff because I can't be everywhere at once. And I've got a lot of you guys that are a lot smarter than me. I'm just the guy that spreads the word. And I come across that and I'm like, holy moly, it really is coming out. It says the new Vaxaroos are sprayed in aerosol form and breathed in by recipients. I'm telling you guys, every sentence, this just bugs me even more. The AeroVax was developed by researchers at the Bill. Let me back that up because there's certain words that I know I can't say. It's that crazy. The AeroVax was developed by researchers at the Billy G and Melinda G Foundation, funded by McMaster University in Canada. I'm not talking about hundreds of thousands. According to researchers, the Canadian Government Institutes of Health Research, the CIHR, has now invested $8 million in taxpayer funding. I had to swallow there for a minute because irks me. Let me know in the comments if it irks you. Into the AeroVax project. Did we even say we wanted that? Are we even approving of that? And then yet our taxpayers are going towards that. AeroVax project as scientists prepare for the next round of clinical tests. The next round. Just like I said, all the lines in the sky that I know all of you guys are seeing has got purpose, and it's not to make the airplane move or get through the sky. It says the scientists developing the experimental Sarova, if that's how you pronounce it, COVID mRNA vax, insists that it will be administered as a nasal spray. Hold on a sec. However, the development of inhaled Vs could allow for large numbers of people to be V'd at once if the AeroVax were sprayed into the atmosphere. And I've told you guys this before. There's planes out there that are contractors, big spraying planes. And when they get these hundreds of thousands, if not $1 million contracts, they don't ask any questions. They've got a fleet of people that come on and deal with all the spray machines, and the guys that drive the plane chart the course that they're paid to chart. Now, like I said, not a word of this is true, but you dig deep enough, you guys might be surprised. So now in this article, it says populations that have that happen to them without their knowledge under such a scheme, these concerns have been previously raised by multiple experts amid the ongoing push to develop the inhaled thing. It says, when you put the pieces of the puzzle together, a disturbing picture emerges. Dr. Joseph Mercola warned when the technology first emerged in 2023. And I think that has to do with the inhaled stuff and the emerging, because like I said, there's a lot of data out there that shows that stuff's been happening for a very long time. And in this case, this is coming from Slay News. It's probably opinion, so take it with a grain of salt, do your own research. Says that this news was reported on the inhaled stuff in 2023 when it began its first phase of trial 1. Now, we all know trial 1 that is actually given to the public without public okay probably was not the original phase 1, right? Can we all agree on that? I highly doubt it, but you never know, I might be wrong. Following an initial study on mice, the results led to researchers to declare that this new method of delivery could radically change the way people are inked. Yeah, real life. How does that make you feel? Let me know in the comments. Let me know if you guys think I'm crazy. Because I'm finding, like I said, pieces of the puzzle are stacking. Then I'm seeing stuff coming out and emerging in 2023. We're finally hearing about it in articles like this, and we all see the lines in the sky. Like, I don't doubt that stuff like this is going on. Let me know. Do you? It even says the first human trials, which they don't give us a date on that. The first human trials saw 36 people participated in the experiment. So screw the mice. They've already been doing it on people, but they make it sound like the first trial, the first phase was on mice. Like, they never give you the whole story. Just they give you little bits and pieces and then make it seem like they're very transparent and telling us the truth. But I'm telling you what, do you guys believe it? I don't. In addition, it said, according to researchers, there were no severe side effects from the phase 1 trials, no severe side effects, which tells me there was side effects. And then what is there to be said about long-term side effects and the development of hypothetically cancer or people just dying off faster or getting sick easier? Like, folks, my brain, my research takes me down some rabbit holes that I could never even begin to share here. But this is a great article to give you guys kind of just a pinch of what you should be aware of. It says that researchers are now rapidly advancing phase 2 trials. It says they are in active recruitment for 350 volunteers for the randomized double-blind trials. Now, my crazy guess is probably that this is just to roll it out. They're gonna tippy-toe around, walk on thin ice, and make it look legit, and who knows? Who knows? Knowing how things go, it's probably been in effect. This is just going to be their slow, soft rollout to public. Like I said, just my opinion. It says a total of 75% of participants will get the real version of the V, while the rest get placebos. 2 versions of the inhaled Civiter that was developed in 2021. They were named Tri-Chad and Tri-Huad, is what it says in this article. Like the mRNA injections, both AeroVax vaccines use some form of the spike protein found in the Civiter virus. You don't say. Both versions were made with HEK293 fatal cell lines, it says. And then the Tri-Huad was packaged and reskewed in HEK293 cells through a 2 plasma coat transfection system. It says read a full. There's probably a link right there. You know what? I'm just going to leave a link to this article down in the description. I did it on the other day's video, and I know some of you guys appreciate it because you want to read it for yourself, and that's great. So I'll leave a link to this down in the description. Abstract of the vaccine. Now, it says that little fatal cell line were derived from kidney tissues taken from an aborted little one in the Netherlands in the 1970s. Okay, so the saga continues. This thing's gonna go deep, and for those of you that deep dive, yeah, have fun with that one. According to McMaster, preclinical trials in animals have already shown that the inhaled aerosol V is more effective at inducing protective immune responses than traditional injections. So they're saying it's really good. Like, you guys should be super excited about this. McMaster claims that this is due to an inhaled version of the V targeting the upper airways where respiratory viruses first enter the body. Meanwhile, the US FDA has granted fast track designation for a new self-amplifying replicon of the mRNA vax to supposedly tackle the H5N1 influenza A virus bird flu. Okay, so see, this is what I'm talking about. They're going to tackle everything, and this all, seriously, it comes back down to the money, because if they can justify something working, whether we approve it or not, we pay for it. And people like Billy G, they get filthy rich because not only the United States needs to have this happen, but the entire world. So when they can justify all this and then we pay for it, it's ugly, folks. It's real ugly. It says the fast track was awarded to Arcturus Therapeutics, a Billy G funded company specializing in, you know what, based pharmaceutical for its ARC-2304 mRNA vax. Man, I'm saying a lot of trigger words here, guys. I hope this thing gets out there. Please share this at the end, because like this video might not go very far. Anyway, it reads on. It says that Slay News has previously reported before the self-amplifying or replicon of the MR shots contain the equipped needed to make more of itself once it enters the cells. And like, you guys have been doing a little bit of research on that. I know some of you have. This is new news to some of you, but this thing multiplies. It multiplies, and that's the real scary thing about it. Like, I'm telling you, some people use the term they're playing God. I feel like it's an understatement these days, because I feel like they could do something really bad that a lot of us could not do anything about. This is not to raise fear. This is just to bring awareness. Like, this might not be true. You know what I'm saying? Like, do your own research. But like I said, I'm a little bit concerned. I'd rather know than not know, but here it is. So anyway, my light went out. Just trying to illuminate a little bit extra in here, and it went out. So image changed, but let me read on real quick. We're almost done. It says that these injects have been dubbed replicon vaxaruis because they are able to replicate inside the human body to produce more, the M word, over time. Anybody that trusts in that word right there that starts with an M, then great for you. I mean, it's gonna reproduce in your body and multiply, and it's gonna save you from everything. But those of you guys that think that it's probably corrupt or bad, this is not good. Furthermore, the new technology has provoked a worldwide backlash from experts and concerned citizens. Just for the record, I would consider myself a concerned citizen. Yet, despite widespread concerns about the new Big V, federal health officials are rushing the development of the new replicon injections. Anyway, there's some buttons to click some more information on that article, but there's things going around. New news places that are not part of mainstream are picking up on this. Anyway, some of the smaller media groups are picking up on this. X is picking up on this, and some shorts are circulating. And then even on X, like, what are people saying? It says, why do they still care so much about the CVITR specifically? What's your guys' answer on that one? Like right here, it's no joke. Volunteers needed to test. No needle. Made in Hamilton. Inhaled V moves to next stage of testing with $8 million in federal funding. That means your money, folks. But these are posts that are going out. People are saying, what the F? Is this real? Another big player on X says it's already happened. It was sprayed from the cell towers. This is only about disclosure. That's what I was saying, folks. They're just softly letting it out there. She says, wake up. They are telling you what they already did. They are telling you this to get you angry, to help wake you up. This is to prevent psychosis. I am telling you the truth. And then she's got a link right there. This one says, Feral Frog, if something like that pic ever happened, I'd go to war over it. Another person says, don't take it. It will change your DNA. There's an opinion. This one says, can you look into this? Do this, please. Any of you guys out there, I'm sorry my lights went out, but look into this. Let me know what you guys find out. My email is always usually in the description. Let me know if you guys find some good stuff. This person says, what I've been saying for quite some years, some time, is that evil ones will probably be spraying the spike proteiner biosweapons in the sky. It's insane, fake, mad science unleashed on the world. And this is kind of what I'm thinking. This is kind of where I mean, it's such a behind the curtain type of movement, and everyone is just living their happy little lives. And I honestly think that even all the way down to like the coal, you know, anything that gets us buying and emptying the shelves at the grocery stores, because they're all owned by the same people and produced by the same people. So I did the math one time, selling out of cough syrup, by the way, it is billions of dollars. This one says, please restrict all Canadians from entering the US. You know, they're concerned about this being okay without their consent, but honestly, you know, I look at the Canadians as the same as the US. It's the governments that are different, right? I've got lots of family in Canada. I love Canada. It's just that their jurisdiction is, there's some things that I do not agree with up there. This person right here says, how can we help Liz stop living in fear of science? You know, there's some people out there that think this is a good thing. And you know what? Everybody's entitled to their own opinion. And I like to hear all input. So let me know in the comments. Anyway, folks, I could read on. There is some crazy, even down in Africa. They're talking about what the guy down there that has his big camp, what's really going on. And Africans are not happy because they feel like they're guinea pigs. Tons of links. You guys want a really interesting read? I'll leave a link to this X post also. And you guys go read through this X post of comments. And if you're not awake, you're gonna wake up, because there's a lot of stuff people are throwing in here that old Elon allows. So whoever approved this spraying command needs to be jailed for crimes against humanity. Look, I'm not even gonna go any further. I just wanted to make this known to everyone, and you guys can do your own research, find out if this is true or if this is fake, whatever. I'm just reading an article that was put out by this company and sharing what people think might be true. Do your own research. Read through these comments, because there's a lot of good, valuable stuff in there that I can't say here. And if you guys appreciate me just trying to keep you guys aware, I don't try to take sides. I'm always open to hear what other people think. I'll give you a little piece of what I might think, but I'm also subject to change if you guys present some really good stuff. But when I see something this crazy that aligns with the stars, I'm gonna try to give it to you. And if you guys like this, you guys might like a couple of these other videos that you may have missed, please click them, please watch them, please hit the like button, share this if you want more people to know about this. And of course, let me know what you think down in the comments. Keep prepping, keep learning, keep doing. Got more coming down the pipe, folks. See you on the next one.